Hi everyone, Dr. Minasri here. Today we'll have a focused look at anesthesia circuits. We'll cover their core function, the main types, key components, and vital safety steps. Let's begin. The circuit delivers life support, a precise mix of oxygen, air, and anesthetic agents to the patient, while ensuring ventilation and removing CO2. It performs four key jobs. First, pressure reduction from the water supply from 3.7 to 1, precise vaporizer mixing, manual or mechanical ventilation, and integrate parameter monitoring. Classification, we have three types. First, open circuits. Historical technique like the open drop method, no longer used due to pollution and lack of control. The second one is semi-open Mapleson circuits. No absorber of CO2 requires high fresh gas flow. Types like the McGill for spontaneous breathing. McGill is the type A Mapleson, and the type D Mapleson, the Bain circuit used for mechanical ventilation. There is pediatric type E and F. They are used in pediatric anesthesia. The Mapleson classified these circuits according to the relative position of APL valve, reservoir bag, and fresh gas flow. 3. Closed or circle system. The modern standards uses CO2 absorber, allowing gas rebreathing. This enables low-flow anesthesia, saving money and preserving patient heat and humidity. Its safe use mandates monitoring of oxygen-inspired fraction, agent concentration, and capnography. Let's highlight the key component of the circle system. First, the CO2 absorber, soda lime. It contains a pH-sensitive colorimetric indicator that changes color as the granules become acidic and approach exhaustion. Risk is carbon monoxide production and exothermic reaction with desiccated absorbent. For best practice, check the absorbent moisture. First, second, replace the canister before complete exhaustion, and gently agitate the canister before use to eliminate channeling. Ventilator and breathing system. Ascending bellows are the safety standard as they will collapse and fail to rise if a circuit disconnection occurs. So performing a pre-operative leak test on the entire breathing circuit and the bellows themselves is a mandatory safety step. APL valve, adjustable pressure limiting valve, also known as the pop-up valve, is a part of pre-use safety checklist. Vaporizers, standard ones for most of agents, and the special heated Tech 6 for desflurane. And the gas delivery system involves three pressure reduction stages for safety and control: high pressure, intermediate pressure, and low pressure. Key safety feature is the oxygen flow meter, being located downstream of other gases to help prevent the delivery of hypoxic gas mixture. The last component is the humidification system. We have the passive and the active one. The passive is the HME filter. These are commonly used. The active is used for prolonged case or in critical care. These systems use a heated water reservoir and or electrical source to actively warm and humidify the inspired gas. We'll talk about important practical concepts. First, low flow anesthesia. We set our fresh gas flow low to match patient's consumption. This saves agents and preserves heat and humidity. Example, a patient's oxygen consumption is approximately 200 to 300 ml minute for maintenance. Therefore, the oxygen fresh gas flow can be set between 300 to 500 milliliter minute. For low-flow anesthesia, a crucial note, low-flow anesthesia mandates continuous monitoring of inspired oxygen fraction, end-tidal CO2 capnography, and expired concentrations of anesthetic agents. The fresh gas flow must be increased during induction and emergence to quickly change the depth of anesthesia. The PEEP valve has a very beneficial role in alveolar recruitment and the prevention of atelectasis. This all leads to the most critical, non-negotiable part: vigilance and the pre-use checklist. Verify oxygen sources, perform leak test, check the CO2 absorber and bellows, ensure monitors for oxygen and CO2 are on and working. Finally, know that if anything goes wrong, the first action is to disconnect and ventilate with self-inflating bag. Thank you all.